Hi all. So today's class on pediatric nursing, the topic covered will be immunization. So what do you mean by immunization? So immunization is a process of giving immunity. So what are the ways that we can confer immunity? Can be broadly divided into two. The first one is natural and the second one is artificial. So what exactly is immunity? Immunity is the ability of our body to fight diseases. And in case of natural immunity, we usually get immunity after we have attained a disease. So if a person acquires a disease, then he will develop an immunity towards that disease. So that is what is meant by natural immunity. And again, it can be divided into active and passive. So how do you get an active natural immunity after getting a disease? So how do we get a passive immunity naturally? Here, a newborn infant is getting preformed antibodies via the breast milk. So the breast milk will confer passive natural immunity via the preformed antibodies that are present in the breast milk, especially colostrum. Okay. So how do we get an artificial immunity? So it can also be either active or passive. And the active immunity means we are giving a vaccine. So what is a vaccine? And passive immunity, we will give a preformed antibodies. So now we are getting into the topic vaccine. So what is a vaccine? So vaccine is the agent that can confer active artificial immunity. So it can either be a microorganism that is either live or killed. In case of a live microorganism, it is a live attenuated. Attenuated means it is inactivated, so that it will only produce a mild disease in the host. And the killed vaccine, it does not produce the disease, but it will activate the immunity. So it does not produce the disease. The live attenuated will produce a milder form of disease, very milder form of disease. And the killed vaccine will not produce the disease, but it will produce the immunity. That is if we are using the microorganism, or we can just use a part of the microorganism. Here, only some part, that is the antigen of the microorganism, is used to produce a vaccine, and it is termed as the subunit vaccine. So these are the type of vaccines that are available. The first one is a live attenuated vaccine. The second one is a killed vaccine. And the third one is a subunit vaccine where an antigen is taken and it is used to produce immunity in the host. So these are the major types of vaccines. So one of the main questions that is being asked in the AIMS Norcet exams is regarding the examples of live vaccines. So this is a very important topic. So you have to know which all vaccines are live vaccines. The first vaccine that is live is the BCG vaccine. Remember, BCG vaccine is a live vaccine. This is a live attenuated vaccine. And the second vaccine is the MMR vaccine. Just remember it as MMR. So measles vaccine, the MR vaccine containing measles and rubella, and also the MMR vaccine, mumps, measles, and rubella. All these three are what? All these three are live vaccine. And the third one is the our two oral vaccines. What are the two oral vaccines? The first one is the oral polio vaccine, also known as Sabin vaccine, and also the rotavirus vaccine. This is the second oral vaccine. Or these two are also what? Live vaccines. So remember, the oral vaccines include oral poliovirus vaccine and the rotavirus vaccine. The OPV and the rotavirus RVV. Both of these are the oral vaccines. So both the oral vaccines are, excuse me. Okay. So both the oral vaccines are a live vaccine, the OPV and the rotavirus vaccine. Similarly, the varicella vaccine, which is used for protection against chickenpox. Then the yellow fever vaccine. Also, one more oral vaccine is there, the oral typhoid vaccine. Okay, so these are the major live vaccines that are available. So you should study this one. The first one is the BCG vaccine, the MMR vaccine, including the measles vaccine, the MR vaccine, the MMR vaccine, then the OPV or the Sabin, then the rotavirus and the oral typhoid vaccines. The three oral vaccines, along with varicella and yellow fever vaccine, these are the major live vaccines that are available. Okay. Then there are some toxoids. What are toxoids? Some organisms, they produce toxins. These toxins are purified and used to form a toxoid, which is a kind of a subunit vaccine. And this include the tetanus toxoid and the diphtheria toxoid. Just remember the terms, tetanus and diphtheria toxoid. And other subunit vaccines include PCV, the pneumococcal vaccine, pneumococcal conjugate vaccine, then the meningococcal vaccine. And all other vaccines come in the group of killed vaccine. So you have to just remember what the live vaccines. Okay. So there are some salient features of live vaccine. Since what happens in live vaccine, there is an infection is occurring. So usually only one dose is sufficient. And it can cause what? A permanent immunity. So the live vaccine, usually one dose is alone is sufficient, and it usually induces a permanent immunity. But in case of killed vaccine, multiple doses are required. And usually booster doses are also required. However, some exception is in case of oral vaccines. In case of oral vaccines, we give multiple doses. So this is regarding what immunization, what are the type of vaccines, and the salient features between live vaccines and uh, killed vaccines. Okay. So another important area that is being tested in the exam is regarding the route of administration. So we have already gone through one route of administration. What was that? That is the oral. And the major vaccines include the OPV, the rotaviral vaccine, and the oral typhoid. Among the first two are in the national immunization schedule, and the OPV is given as a 2 drops. The dosage is 2 drops, and the rotaviral vaccine is 2.5 ml. 2.5 ml. This can be asked as a question. So the oral polio vaccine, 2 drops are given, and the rotaviral vaccine, it is given as a dose of 2.5 ml, and the vaccine that is used is Rotacil. Just remember it, Rotacil, and the dosage is 2.5 ml is the dosage. So that is the first route, that is the oral route. And the second route is what? The intradermal. So intradermal route. So what are the vaccines that are being given in the intradermal route? That is the BCG vaccine and also the fractional IPV vaccine. Fractional IPV vaccine. And the IPV vaccine is the injectable polio vaccine. The injectable polio vaccine, which is given as a fractional IPV. So in the national immunization schedule, it is given as a fractional dose, and such dose is given via the intradermal route. So the dosage is 0.1 ml. BCG also the dosage is 0.1 ml. One important question that is being asked in case of BCG is the dosage. So the dosage at birth is 0.05 ml. So at birth, you can give BCG as 0.05 ml. All other time, it is given as 0.1 ml. So this is a thing that you have to know. At birth, the dosage of BCG is just 0.05 ml, and at all other time, it is 0.1 ml. So that is regarding BCG, and the fractional IPV vaccine is 0.1 ml. So this is the intradermal route. So where do you give the intradermal route? So it is given at the upper part of arm. The upper part of arm. BCG, where do you give it? The upper part of left arm. Upper left arm. So these are the questions that are usually asked with respect to BCG. The BCG route is intradermal route, and the dosage is 0.1 ml. At birth, it is 0.05 ml, and it is being given at upper left arm. And the fractional IPV vaccine, it is 0.1 ml. Okay, so that is regarding intradermal route. So next route is the subcutaneous route. So what are the vaccines that are being given as subcutaneous? The first one is measles vaccine and all other measles containing vaccine. That is the MR, the MMR. Okay. And the next vaccine, main vaccine is the varicella. Always remember this varicella is similar to measles only. The measles and chickenpox go hand in hand. Both are what? Both are live vaccines and both are given as a subcutaneous route. And here the dosage is 0.5 ml. The subcutaneous route, the dosage is 0.5 ml. Where is the site? The site is in infants, it is anterolateral aspect of thigh, and in older children, upper part of triceps. Okay. So this is regarding the subcutaneous route. The fourth route is the IM route or the intramuscular route. So what are the vaccines that are being? Almost all other vaccines are given as intramuscular route. So example is the pentavalent vaccine. So what is the pentavalent vaccine? It contains diphtheria, tetanus, pertussis, H influenza B, and hepatitis B. So these are the 5 components of the pentavalent vaccine. It can be asked as a question. So what do you mean by pentavalent vaccine is another question. So it contains diphtheria, tetanus, pertussis, the DTP, the H influenza B, and the hepatitis B. So these are the constituents of pentavalent vaccine. So naturally, the DTP, the TT, the TD, all are what? All these are IM vaccines, okay, intramuscular vaccines. And other vaccines such as the pneumococcal vaccine, the PCV vaccine, it is also an IM vaccine. So these are the major IM vaccine. Just remember the oral ones, the intradermal ones, the subcutaneous ones. Virtually all others will come under IM vaccine. And the dosage is what? It is also 0.5 ml. Only the intradermal vaccines are 0.1 ml. Both the subcutaneous vaccines and the intramuscular vaccines are 0.5 ml. So coming to the site, again in infants, it is the anterolateral aspect of thigh. And in children, it is the deltoid. Remember, the gluteal region is not preferred. Why? There is a risk of injury to sciatic nerve. Always remember in infants, it is the anterolateral aspect of thigh. So one question was asked, which muscle is the ideal muscle? And the answer is vastus lateralis. Vastus lateralis. This was a previous question. So this is the muscle that is found in the anterolateral aspect of the thigh. And among the options, it was given what? Gluteus maximus was given. So obviously, don't fall for it. Gluteal region is not preferred due to risk of injury to sciatic nerve, and especially in infants, the anterolateral aspect of thigh is the most preferred site. And the definite muscle is, if asked, the answer is vastus lateralis. Okay. So this you must be knowing. One another question that is being asked is, what gauge of needles that can be used? So in case of IM, 22 to 25 gauge, and in case of subcutaneous, 25 to 27, and in intradermal also 25 to 27 gauge needles can be used. So just remember the 4 routes. I hope you can see. The first one is the oral route, the intradermal route, the subcutaneous route, and the IM route. So just we have covered what all things? We have covered the basics of immunization, the types of immunization, regarding the types of vaccines, the live vaccines, the killed vaccines, and the subunit vaccine. And we have just discussed on the 4 different routes of immunization or vaccination. Okay. So now we will go through some common principles. Some common principles of vaccination. Okay. The first one is regarding the live vaccines. Okay. 2 different live vaccines. The two different live vaccines can be given either simultaneously or 4 weeks apart. Okay. In case of killed vaccine, two different killed vaccines can be given simultaneously or at any interval. So always remember, in case of live vaccines, if it is two different live vaccines, for example, what BCG and measles, BCG and rotavirus vaccine, either it can be given simultaneously or 4 weeks apart. So these are the common principles that you should be aware while we are giving what? Catch-up immunization. Catch-up immunization. So this is being, the principles are directly asked in the questions, and also it is applicable if we are solving questions regarding the catch-up immunization. So the first principle is the live vaccines. Two different live vaccines can either be given simultaneously. So any number of live vaccines can be given simultaneously, or it should be given 4 weeks apart. But in case of killed vaccines, the two different killed vaccines can be given simultaneously or at any interval between them. And two doses of the same vaccine. Two doses of the same vaccine is ideally given 4 weeks apart. So after giving the first dose, the second dose should be at least 4 weeks apart for good immunogenicity, for good immune response. So that is regarding the two doses of the same vaccines. Okay. And another one is minor illness, such as the child is having low-grade fever, or the child is having some running nose or occasional cough. Such minor illness is not a contraindication to vaccination. Always remember, minor illness is not a contraindication to vaccination. So these are the, so there are many principles. I'm just highlighting the basic important ones. So live vaccines, two different live vaccines can be given simultaneously or 4 weeks apart. This is the main important point in the whole of this part. And the minor illness is not a contraindication to vaccination. So that is regarding the common principles of vaccination. Okay.